What I'm excited about and having the opportunity to speak to you is relevant to this is the ability to engage our colleagues in thinking about this. It's something that we need to do really in an organized way. We need to do it in clinical practice, day-to-day practice, but also in our training programs. So I think this is a real call to action to provide training to neurologists and to the advanced practice providers and other team members with whom we work about healthcare disparities to be thinking about it. I was struck that only 50% of respondents thought race and ethnicity was a driver of disparities in healthcare. I think the number is probably a lot higher than that. So we do have a lot of sensitivity to this, particularly when it comes to access to therapies, because everyone's worried about the cost of these. But I think that there's an opportunity to better educate one another and think about the impact at a patient level. You know, a few years ago, my good and dear friend Ted Burns and I wrote something for Stat News about how important it was to ask patients about financial toxicity. And I think we framed it the fourth or fifth vital sign, however many other vital signs there are. And if you don't ask patients about their ability to afford a medicine, or you don't inquire about their ability to get to your clinic, then you're likely to have trouble. I just moved my clinic from downtown Richmond, which is right in the population that we're serving, out to a suburban location for an administrative necessity. And there were many of my patients who couldn't come because our new clinic, or my new clinic, is not on the bus line, right? And so fortunately, I have colleagues that work downtown and are able to take care of those patients. But if you don't ask the questions, you can't provide the care. And so I think this, to me, is a call to arms to just make sure that all of our colleagues are aware of this as an issue and work together to try and address it.